All right. Good morning, everyone. Welcome. It's good to have you here today. Those of you that are in person and those of you that are online, we're glad you could join us as well. The York County Community Foundation is celebrating our 60th year. If you haven't been hearing that all year, we haven't been communicating well. I think you've probably seen it on our social media and our annual meetings. But 60 years is really an exciting milestone for us. And I think what we've learned over those 60 years is that the power of the foundation, the value we add, is in bringing our engaged donors and the community together to really solve for creating a prosperous community for all. You know, we've really worked hard, and when I say we, I'm not taking any credit for that. Oh, I'm sorry to introduce myself. I'm Krista Dar. I'm the chair of the board of the foundation, but our staff at the foundation works really hard at connecting with our community stakeholders so that we feel like we have a really good understanding of those greatest needs in the community that will help us create that prosperous environment for all. And then the other piece to it is we've got engaged donors, right? And so if we can bring you all together, we really can make change happen in our community. And so when I think about our donors, you all here today, I think of a quote from Margaret Mead, who said, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." And so I thank you all for being those committed citizens and being here today to hear more about what we're focused on at the foundation and how we're making a change in the community. Now I'm going to go ahead and turn things over to Jane.
That way. Good morning. Thank you, Krista. Thank you so much. I'm Jane Conover. I'm the president of the York County Community Foundation, and happy summer of 2021. It's so good to see you all here and on the screens. It's been a really active summer for me, maybe a little bit too active. You'll see my crutches. As I was scooting across beautiful York County, I fell off my scooter and I injured my knee. So it couldn't stop me from being with you, those here today, for this important conversation. We're really here for two reasons. The first reason is to thank everyone who's given to the COVID Response Fund and to all the service providers that really ramped up their work to serve those that were most impacted by the COVID pandemic. Thank you so much. We're very, very grateful, and we're glad to be able to salute you today. The second reason we're here is because we want to feed your desire to be informed donors. You know, you're the kind of donor who not only wants to see the impact of your gift, but you also want to understand the underlying causes of the problems we're trying to address. And that's the kind of exciting partnerships we're looking for at the Community Foundation, to invest in transformational projects that meet a need, but that also make long-term community impact. So I know most of us have wanted to put the COVID pandemic in the rearview mirror. I know that I have, but there's been a lot of good things that have happened over the past year that I think are worth noting. And that's why we're here today. We're talking about the call to action that the COVID pandemic created for our community and how we all responded. There is a report at each person's seat here about the COVID Fund and the work that it's done. And then the folks that are joining us on Zoom will get that in the email shortly. The response to the call to gifts to the COVID-19 Response Fund was really extraordinary. Over $1.1 million was raised, starting with a lead gift of $100,000 from the Community Foundation, but then quickly followed with a gift from the Women's Giving Circle, a gift from our private foundations at Wareheim and Powder Mill Foundations. $350,000 of that came from individuals, $86,000 came from companies, and another over $55,000 came from donor advisors who had funds at the Community Foundation. I think the isolation of the pandemic really heightened our need for connection, feeling like we belong to something bigger than what's in our living rooms or in our home offices. And the COVID-19 Response Fund, I think, gave people an opportunity to connect and give back to their own community and be part of the response. The Community Foundation was well suited to help lead the philanthropic response to this crisis for several reasons. First is we had some flexible funding. Our Fund for York County was created over many years by generous donors who were interested in trying to create a flexible fund that was available to meet the emergent needs of our community. And obviously in 2020, the COVID pandemic was an emergent need in our community, and we were able to use flexible dollars to seed this fund. The second reason is that we have really positive relationships with other philanthropic philanthropic organizations in the community, and we were able to call on them, and they stepped up immediately to be able to add to the fund. And then the third reason is we really have a powerful grants team at the Community Foundation that is connected to a network of community foundations across the country so they could tap into what are the best practices for responding to this crisis, and also to call on our nonprofit and government partners in the community to be able to design a grant program that was most impactful. In short, we were ready. And thankfully today is a chance for us to step back and take a look at that rearview mirror and look at lessons learned. For us at the Community Foundation, we learned three important things. First, we learned that we would include the people doing the work and the people impacted by the work more in our grant program design and in our decision-making. Second, we would streamline our grant processes to make it easier to access our resources and for quicker decision-making. And third, we'll continue to cultivate funder partnerships so that we can leverage our grant dollars even farther. At YCCF, we're taking what we learned over this past year to refresh our grant programs, integrate diversity, equity, and inclusion into our work, and to deepen our conversations with donors like you in this room about transformational philanthropy. Today, you'll hear compelling stories of how people were saved from the brink through the COVID Response Fund. And you'll also get to see behind those headlines to learn about what it really took for these nonprofit service providers to ramp up quickly, collaborate in deeper ways, and to pivot their operations to help more people more quickly. The impact of the past year continues to challenge our nonprofit sector. That's why we're really grateful to have some nonprofit dynamos with us today. They are going to share their lessons learned and also what the future looks like for them and their work. As donors, it's really important for us to listen to that and to learn as well so that we can continue to direct our grant dollars towards the greatest good. So I'd like to introduce our own dynamo, Lisa Levin, who's Vice President of our Community Investment Department. And I want to just thank her and her team for being really wise and tirelessly working to deploy these dollars in effective ways. Again, deploying over $700,000 in a quick turnaround in a very effective way with partners. So Lisa, why don't you're gonna come up and moderate the panel, and thank you again for being here.
We should have practiced this dance. Thank you, Jane, and good morning, everyone. I'm really glad to see you all here today. I want to recognize Roth Prep, who was really instrumental in getting these grants out so quickly. There's a lot of process always. Those of you who are grant makers know that, and moving quickly was something that Roth was very helpful with. So as soon as the Community Foundation decided to create a response fund, we began researching what other community foundations across the country were doing, and everyone was scrambling. At that point, there were maybe 50 community foundations who had created response funds. So within 2 weeks, we were able to convene advisory groups to help determine how and where to grant. And we were then able to make our first grants in April, just 1 month after the country shut down. The first decision we made was to focus our grant making so we could maximize impact. Along with COVID funds across the country, our primary focus was on preventing housing and food insecurity. In fact, by the end of last year, basic needs calls around issues like housing and food at PA 211 were up over 75%. Our only deviation was our grants to child care centers, to help them keep their programs running so parents could return to work. Because we were able to be nimble and grant early, we were able to help address food and housing needs when there wasn't yet any public funding available. One common thread across all of our grantees was that they were overwhelmed by families saying, "I never thought I'd be here." With our second round of grants, we've adapted our granting strategies as public policies and funding streams have evolved. One example is with housing. There's now millions of dollars in public funding available for preventing evictions in York County. Still, the eviction moratorium, which has been in place for well over a year, is expiring in 2 days. And social service providers across the country expect a wave of homelessness. They also expect this to worsen when expanded unemployment benefits expire this fall. Our grant work is now informed by a study we funded at Fourth Economy to update its results from a year earlier. We're really proud to have funded the study. Not only is it informing our work, but the county and other nonprofits are using the data to make critical decisions for themselves as well. I want to thank the incredible commitment of our advisory committees who spent hours making tough decisions and were really selfless in putting aside their own needs to focus on the greater good. It's been a huge honor to work with them, and this work could not have gotten done without their support. One final thing I want to mention, while we're really proud of the thousands of people our nonprofit partners could feed and house throughout this crisis with this funding, the Community Foundation wanted to find a way to help other nonprofits that weren't engaged in that work. So we set up a special grants program from our Fund for York County to help nonprofits deliver service in new ways after COVID-19. That program launched last month, and it'll be granting by this fall. So I'd like to invite our panelists to have a seat up front, and I will introduce them. So Jessica, if you'll sit here, Ruth and Joe. Okay, thanks. So Joe Arthur is all the way on the left, if you couldn't guess. Joe was appointed Executive Director of the Central Pennsylvania Food Bank in 2012 after serving 4 years as Associate Director. Joe also served as a volunteer board member with the food bank from 2000 through 2005, and he served as its board president in 2004 and 2005. As the food bank's principal ambassador and a leader in anti-hunger work, Joe presents regularly on the issue of hunger in Pennsylvania and nationally to community groups, legislative gatherings, government partners, prospective donor organizations, and other forums. Ruth Robbins has been the Chief Program Officer at Community Progress Council since 2017. Ruth has leadership responsibility for CPC's 10 programs, and those programs are early childhood programs, housing, counseling, and education, foster grandparents, workforce development, WIC, York City Community of Help, and the Self-Sufficiency Program. Prior to moving to York, Ruth worked in higher education for 20 years. And to my left is Jessica Mockabee. Jessica has worked for the county for 19 years and currently serves as the Assistant Director of the York County Human Services Division. Jessica administers numerous grants on behalf of the county and serves on many committees at the state and local levels. In addition, once we were informed by our advisory groups, Jessica and representatives from United Way were critical in working with the Community Foundation to finalize all grant decisions from the COVID Response Fund. Thank you all for being here today. So first question, how will you take what you've learned about collaboration during the pandemic and use that to inform your future work among agencies? And I'm going to start with Jessica, and we'll go down the line.
The pandemic was truly the opportunity to step back and look at the system as a whole. I think in government, we tend to work in our silo. We follow our government regulations, but this partnership provided us the opportunity to get the right people at the right tables and help assess the areas of greatest need and make the important decisions as to what to do with the use of the funds. Our efforts were successful because we created a vision, but we're flexible and nimble. That's a word we used a lot in all of our planning, nimble, as new programs were formed and we adapted accordingly.
Thank you, Ruth.
Thank you. The thing that came to mind for me first was that the constraints were sort of moved, right? The boundaries were taken away, and we were able to bring a group of people together to solve a problem without thinking about the silo and the funding and how do we make it work. And so there were nonprofits that came together, there were government agencies that were there, but we also brought landlords to the table, and people who were, on all sides of this issue were able to sit together and think about how do we solve an issue. We were one of the organizations that were granted funding, and there were many who were not. And what we found, and we'll talk about the emergency rent program in a minute, is that we're a large organization, but we can't do the work alone. And there are many organizations that are grassroots that are out there that we are required to be working with them in order to make this be effective. And I think the pandemic provided that opportunity for us to think differently about how we work, who we work with, and how we get the work done.
Thank you, Ruth, and thank you everybody for supporting the York County Community Foundation, an amazing partner of ours. We had to change a lot of what we did in our food bank and our partner agencies, and we learned a lot, particularly early in the pandemic. And we are going to retain some of those practices as we move forward. But a lot of our working models just immediately became obsolete in the pandemic. Gathering people up into a small space was a really bad idea, and a lot of our work centered around that. And as you know by now, early in the pandemic, job losses skyrocketed early. And so demand went up 40 to 50% in York County and throughout the entire Susquehanna Valley. And yet we could not serve people in the ways we were used to doing. So very quickly, we had to pull together not only our own team, but consult with our community partners. How are we going to get this work done? How are we going to keep people safe doing it? How are we going to keep volunteers safe? While everything that was going on last spring was going on, and anxiety was at a peak level, but it worked. And here in York County, I will tell you, I have 27 counties that I get a view on. In York County being well organized going into the pandemic, York County Food Bank really being at the table, as opposed to a kind of a funder that's sort of back in the background, was really important, because there were a lot of gaps and the government dollars were not flowing yet. And this foundation was very helpful to making sure that early on we had the confidence to say yes to demands that were being made, knowing that we would be able to meet the need, knowing we could say, yes, we can do it, we'll get the dollars, we can do it. And I can't tell you how important that was, having early confidence when most people did not have a lot of confidence in the pandemic. So thank you.
Thanks, Joe. That issue of silos is an interesting one because Jessica introduced it in county government, but I remember Ruth mentioning it as well, that within all of those programs and all of those program departments, each kind of did its own thing. And the pandemic kind of forced us to find new ways of working. And I think as a funding community, in my experience in York, that was one of the first times that we were all working together. I know I called WellSpan when they had an open grant program to say, what is your program doing? Because we don't want to have the same thing. And so I think we learned that a lot of the reasons we thought we had to stay in silos, in fact, were kind of artificial. And that was, I think, great learning. So next question, and I guess this time I'll start with you, Ruth. What is different in your sector now, and what is on the horizon in the next 6 months to 2 years?
So as many of you know, Community Progress Council traditionally has been working with people to move them out of poverty and towards self-sufficiency. And the people that we're seeing, obviously we're still seeing people who are living in poverty, but the broad range of people that are coming to us who need help are not just the most destitute. We talked earlier that there are people coming to us who would say, I never thought I would need this kind of assistance. And so it really has leveled, the virus has leveled the playing field in a lot of ways, that people understand that this could happen to me. And then what will I do and how will I plan differently? So I think, you will see that we will be reaching out to a broader audience. Obviously, we are always going to be wanting to work with the people who need us the absolute most, but that group is going to change over time, and we're going to see a difference. Something that I thought about this morning was that, traditionally, community action agencies are funded by Community Services Block Grant, and those funds are allowed to serve people up to 125% of the poverty level. During the pandemic, there was an emergency authorization to serve people up to 200% of the poverty level. Well, guess what? People at 200% of the poverty level are still pretty poor. However, we have the ability to serve those folks, and there's legislation underway right now to keep it at 200% of the poverty level. So when you think about the people we've traditionally served, and now how that will expand, our audience is going to broaden. And so, the question about right now, there are lots of funds available right now. Again, there's $30 million on the table for York County for rent assistance. That's not going to be here forever. And it's not going to be the magic solution to get people out of poverty. That's not going to go away in just a couple of years. So the concern is when the big funding goes away, then what will happen? Because there will still be a lot of people who will need it.
Thank you, Ruth. I do want to reiterate what Ruth said about the people that were impacted. We really did learn in the pandemic. And when I say we, the broad public, I think in our work, we believed for a long time that it could happen to anybody. But I think we were in a small minority that really believed that. And now I think we're in a large majority because it did impact so many people across all industries, all work environments, just overnight. Many went out of business. So, for the next 6 months, we believe with the amount of federal supports that have come out, most recently the child tax credit, which at Central Penn Food Bank we cheer on because that's helping people directly. That's having the effect of reducing demand right now for our services. So what we're doing, we're in what we call recovery phase. We went from crisis, which was 40 to 50% more demand, millions more pounds of food needed in York County, and all the distribution that goes along it, to kind of a pre-pandemic level. But we know when those federal supports taper off at the household level, we're probably going to be seeing an increase again. Hopefully not like what we saw in 2020, but certainly more than we're seeing now. So we're in kind of a rebuilding mode and investing in our partners to build resilience. So do you remember when the food in the grocery store was gone? Right. And just sort of, you had to settle for like weird food, right? Brands that maybe really aren't brands, things like that. But what we all learned, less, on the serious side, meatpacking plants closing because employees were getting hugely sick at these big consolidated plants, right? That's just an example of what was happening in the food systems. So all of that consolidation that was keeping our cost of our food low for everybody, we saw the vulnerability of all of that. So we're actually investing right now in local food sourcing as what we hope will be a major channel of food 3 or 4 years out, connecting our partners. We have over 80 partner organizations that we work in York County alone. And 2 of them are represented here, 3 actually, the foundation's a partner. But in terms of actually serving people, over 80 partners, some of the names: York County Food Bank, York Benevolent, Catholic Harvest, New Hope Ministries, and 76 more of them that I can't rattle off. And they were amazing in the pandemic, but we want to connect them with smaller farms and markets the way we connect with large farms in the grocery industry, and provide grants and other assistance to build that out. So that's an example of investment we're making now, because 2 years from now, we think we're really going to need that. And it has an economic benefit as well. So we're hoping that our food industries can grow locally, because it's a really good idea to grow our food systems locally, just as an example. But 2 years out, we think we do think it's going to be much more challenging than it is right now, even though there's all these resources flowing. And I'll close with the point that in the food insecurity world, that's mostly privately funded by people like you. Normally it's about 80-20, 80 private, 20 leveraging government programs. That stayed remarkably consistent through the pandemic. All of the numbers went up, but the donor numbers went up extraordinarily. So we're very thankful for that. And that without that private support, we wouldn't be able to meet the needs that are here now or in the future. So thank you.
Thank you, Joe. Ruth and Jessica, Joe mentioned 2 years. Do you have a planning horizon where you think you're hoping to return to a normal, or what your expectation is in terms of service numbers? If the answer is no, that's fine. I'm just curious.
I'm not sure that I know what normal is. Community Progress Council is going through a strategic planning process to develop a 5-year plan. And, you know, this might be jumping ahead, but we talked about this earlier. We're going to be in a housing crisis. There just isn't enough affordable, safe and affordable housing in York County. And so someone is going to have to try to tackle development in a very significant way for low-income folks. So I don't know that I have a 2-year answer, but I think over the next 5 to 10 years, that'll probably be a significant focus.
Jessica, any thoughts about 2 years?
I guess my primary concern is the housing market right now with all of these houses up for sale in York. We're worried that we're losing landlords, and then people are buying them at higher prices, which means if they continue to rent them out, they'll have to rent them out at higher prices in order to make a profit. So just truly worried about where people who have low incomes are going to live. We at the county level, we had also seen a major increase during the pandemic of crisis mental health issues for both youth and children, youth and adults, and also increased substance use issues, including overdose deaths. And of course, I think you've all heard about the truancy issues, which can lead to involvement with the Office of Children, Youth, and Families. So getting all of those people linked to their critical services is kind of the primary goal, and then looking at these bigger picture housing issues for years to come and trying to find ways to create more safe and affordable housing.
Anybody have any stories about people you serve that you would like to share? Joe.
Since I'm holding the microphone. I do. We're blessed at our food bank. We have a very good small communications team. And if you get a chance, we have a YouTube channel for Central Pennsylvania Food Bank. And we do have some videos out there. And one that really resonates, they all resonate, but one that particularly resonates with me, it's called Give Hope Now, Meet Greg. So Greg is so inspiring. He lost his job during the pandemic, was willing to go on camera and do a video, first of all, which is very courageous. And so his family was really struggling during the height of the pandemic. But Greg shared such a message of encouragement to others that were struggling, and so many people were struggling, to just find help. You know, go to your food pantry, go to all of the agencies that are providing support. Take that support because you really need it. If you're going to get back on your feet, if you're going to be ready when your job reopens. It's the most inspiring video because Greg is coaching people, even though he's having trouble putting food on the table. He's coaching people to just steady as she goes, get the help you can need, tough this out, and you'll be back. And so if you get a chance, check that video out. It is inspiring.
I sent a couple of texts over the last couple of days to our staff saying, I'm going to this event, tell me some good stories. And I got a lot of good ones. The one that stands out is, you know, it sort of raises the awareness of how complicated these issues are. So this is a single mom, now single, was going through a domestic violence issue. So had to leave that home, got a new home, and couldn't work, because she had children. And so she was in the home and wasn't able to pay her utility bills. So all of the utilities were turned off. She has small children. She started to pay for a hotel with the little money that she had so that she could have a roof over the head that had utilities on, and ran out of money to pay for a hotel. And so she wasn't really homeless, right? She had a home. She had paid the rent. She just didn't have utilities. And so we were able to, and this gives you a picture of what some of these utility bills look like. She had a $1,000 water bill, a $2,000 electric bill, and a $2,000 gas bill. So we were able to reset all of those, pay all of those. She had the utilities turned back within 24 hours, was able to get back into the home. But the clincher here is that obviously she needs more support than that, right? I've said since the beginning, we can't put a Band-Aid on a fire hose. It's just not going to hold. But now she's connected to us. So she has a coach with us. We've connected her with CCIS to get childcare support. So her children can get into childcare so she can go back to work. That's the only way that this is going to work, or we're going to see that mom over and over and over again because she can't work. And so she can't work to support her family. So it raises, I said domestic violence, I said utilities, I said housing. There are so many issues that are impacting folks that, bringing a bunch of services together will ultimately be the thing that helps people move beyond this.
Actually, Ruth, you might want to hold on to that because my next question, I think, I'm going to start with you. But I do want to just lift up a couple of things that I've learned through working with nonprofits and the people on this panel. And that is, there are hundreds of people in York County living in hotels and motels. It's a whole world of people. There's also a whole world of people who regularly make choices between having their lights on and putting food on the table. And there's some grassroots community leaders who that's what's informed their passion for the work. They know what it was like as kids. They didn't have their electricity on for a month. I recall one gentleman telling me that, and neither did his friends. That was it's just one of those things. So there's a whole parallel universe that is going on in York County, and this pandemic introduced new people to that life, and it's their normal. So I want to start with Ruth to ask, what was important about accessing philanthropic funding to assist during this time?
I will always say that it fills gaps because we are so restricted by government funding and all the rules that come along with that, that oftentimes, you really want to help someone. And there just isn't a funding source, and Jessica will probably say this too, is that you've got to meet very specific criteria in order to receive this kind of help. And so, we'll call 3 agencies to say, this person is in need. What funding do you have, and can you help them? What funding do you have? And sometimes there is no funding. And so we were very, in April and May, I give a ton of credit to this fund because we were ahead of the curve. We were having conversations about eviction prevention before that was even on the radar. And again, bringing people to the table to talk about that. We were able to fill gaps. We were able to say to someone, you know what, there's no funding source for that. You were employed until 3 weeks ago, but you weren't able to pay that rent. There isn't really anything to do that, but you know what, there's a new fund, and that fund can help you do that. We talk a lot about the gap at Community Progress Council because when people start to make a little bit more money, they start to also lose public assistance. And so sometimes they can't afford to take a raise. If they take the raise, they're going to lose the childcare subsidy, or they're going to lose, the food benefit. And so we always say, if we can fill the gap for those folks, they can take that raise so that they can get the next raise. And that's what we have to keep pushing for. $12 an hour isn't going to cut it for a family. But if it can get to 15, 16, 17, 18, that makes a significant difference. They're not going to go immediately from 12 to 18. So filling that gap, paying rent for a little while, paying childcare for a little while, might be the thing that helps people get to the next level.
Thank you. Joe, right before you go, CPC is an interesting example of, in very early conversations with eviction prevention funding, the discussion was around how do people know that it's available? And CPC was really creative, and they got a grant for a communication. I mean, who knew you'd be marketing, come ACT. What was the acronym?
Assess, contact, and
Assess, contact, and something. But it was driving people to where services. Then they were with other nonprofits. They had eviction funding before there was public funding, and then as public funding became available, what did they need but staffing? Because now they have millions of dollars to deploy of public funding, but you can't just flip a switch and start doing that. So Joe, just a reminder, the question was what was important about accessing philanthropic funding to assist during this time?
I'm glad you repeated that because I don't have as good a memory as Ruth does. It was everything, really. Our as I mentioned earlier, our model relies on philanthropic funding for 80% of our mission. Early on, we really didn't know how big this was going to be, how much it was going to take in funding, and if our donors were going to be in a position to actually help, because they were losing jobs too. Their businesses were struggling. A lot of our donors, direct donors, are just folks, and they were hurting too. But so many stepped up because they had confidence that the dollars would be used well and go right into the crisis. And so we needed some well-known organizations to step up first. And this fund was one that stepped up first. In York County, probably the best example I can think of was when York County Food Bank, our partner, set up the Haynes Road Emergency Center, which became the single largest point of service, not in York County, but in our 27 county territory. The whole Susquehanna Valley, more people were being served at Haynes Road during the pandemic than any other location in our territory, inclusive of Harrisburg, inclusive of Lancaster. And those have bigger populations. And this fund invested in that setup because the answer could have been no. The answer could have been, we'd love to do that, but where are we going to get the money? So this fund set up by the foundation and United Way invested early, and then more dollars followed along and stayed along through the whole pandemic. And actually it still serves today. But I think that's the biggest success story I can think of. It's not the only one, but it's the biggest one.
Thank you, Joe. Jessica?
Just to echo what Ruth has already said, just the COVID response funds were critical in filling the gaps. Early on in the pandemic, we had not received CARES or Recovery Act funds from the county, so we were able to prevent those evictions early on. Then when public dollars did become available for rental assistance programs, we shifted gears and through our work identified a new major gap with homeless shelters' ability to take fewer individuals due to lower capacity settings through CDC recommendations. We knew that there could be a number of people who would have no shelter in the cold winter months. So new emergency shelter funding is definitely hard to get. It's out of vogue in the homeless world. So having access to these funds was crucial. They were used to fund the Code Blue emergency shelter, which kept people safe and warm and off the streets. After that hurdle, we knew we had another problem that was a reoccurring theme in our advisory group meetings. With the eviction moratorium placing financial pressure on landlords, we began to hear that landlords may not be as likely to work with people who receive various rent subsidies or programs from agencies like Housing Authority or Bell Next Door. So we pivoted once again to develop a landlord risk mitigation fund to provide an incentive for landlords to work with consumers who may have spotty credit and rental histories, offering landlords an incentive to kind of work with this higher risk of a group of consumers. And so that's in the works now. So again, without these funds, we would not have been able to hit these as a gaps. I don't know what else to call them, but gaps.
Thank you, Jess. And that's sort of hot off the press. We're still working with risk mitigation. There's an RFP out. We're looking for a nonprofit agency with experience in that kind of work to take it on. But we're all, I think, candidly frightened of what's going to happen after this week. We know that there are a lot of people who are going to be evicted. We know that scarce housing is much scarcer now, much more expensive. Roth, I'm not picking on you, but Roth just rented an apartment in the city and he got turned down many times, even though he's a fabulous candidate, because landlords have their pick of who they want to select as tenants right now. So it's something that I know we're all going to be keeping a close eye on. One last question, and then we'll open it up. What is the most important thing you'll focus on moving forward? Jess.
I think to continue to work with the nonprofits and the Foundation for Private Funds, because we can't just continue to do this work piecemeal, which I think we tend to do sometimes. You know, we're limited with regulations, but if we partner with, you know, the foundation or other nonprofits, we can solve problems in a more holistic way. For example, and I'll talk about it probably to the day I die, is the lack of safe and affordable housing for low-income people. We've made no progress in that regard, and it's something we need to continue to try to work on. And it's going to take all of us working together to put a dent in that problem.
I would say that CPC will continue trying to work on comprehensive services for families. Right now, because of the way that we're pushing money out the door, it is a very anonymous process. So it's an online application. We're getting people funded, we're paying landlords, and we could say, okay, we did our job. But that our job is just beginning. Once we get folks that have their rent paid, have their utilities paid, and they're stabilized, that's the time that the really hard work needs to happen. I would say the next 2 years, we will be focusing on how do we reach the thousands of people that we were able to help, to say, how else might we help you, so that we can plan, so that you can put a goal in place, so that you don't find yourself in this place ever again. Obviously, this happened to people, right? This pandemic was not anything anyone expected. So it threw people for a real loop. And so we need to figure out how we're going to continue to reach those folks, how we're going to be seen as not just an agency that helps the super poor, but helps everyone who needs to make their way towards self-sufficiency. And that's a big hurdle. And I think people will start to recognize that. I think the movement around companies paying people better, you know, you see the signs as you drive around that you can go to Rutter's and make $15 an hour. That's going to apply pressure broadly and help people understand that people need to make that kind of money in order to put a roof over their head and be able to pay their utilities. But Rutter's isn't the career, it's the job. And so how do we get people to the place where we can get them to a career that is maybe more sustainable, and get to a place where they're making more than $15 an hour.
Before you pass the mic, so I want mic drop. I want Ruth to talk about how much money they've pushed out. That you mentioned $30 million in housing assistance. I'd like to hear about how much money you've pushed out the door as of today, and how's York County doing compared to our neighboring counties?
So we started our program on March 22nd, which is way ahead of a lot of the other counties in the state. And that was a team of people literally working 24 hours a day to try to get a system up and running. And we have given out, as of yesterday, just under $8 million in 4 months to about 2,000 recipients. There are still 4,000 applications in the hopper. 2,000 that are still in application stage. They haven't submitted yet, so we can't work on them. And then about another 2,000 where they're partially completed. Oftentimes we're waiting for landlords to respond to the application, which is what a little bit of the holdup is. So I expect this week, actually, we're going to start seeing the number rise exponentially because prior to now, we were paying back rent and we can only pay 3 months forward rent at a time. So people who are now eligible for an additional 3 months of funding, we will start to be able to process those faster. So we're still in the first batch of money. We received $13 million from a federal allocation directly to the county. And then we have another 17 behind that that came through the state, and we'll be starting those funds probably in September when we expend 13. And there's another rent assistance right behind it. This is ERAP 1, and there's ERAP 2 coming in 2022, which will mean there will be more funding available.
Thank you, Ruth.
You know, broadly speaking, the two groups that we went into the pandemic knowing that we had more work to do to reach people, people of color, and our rural residents. Those, broadly speaking, those two groups were underserved, and the pandemic has not made that better. It's made it worse. So working more closely with our community partners, listening more to our communities that we do serve, and we're trying to figure out how to get better at that as well, is really important for us to kind of redesign our services. Include transportation in that, because we have so many people who are either isolated or they have their own transportation challenges. We've gotten the healthy food thing down on the sourcing side, the distribution, but if we can't get that food to people in need, then it's not doing any good. We know that particularly in our rural areas, it's really a challenge to get people to sign up for things like supplemental nutrition benefits, which gets folks in the grocery store. It's good for everybody. We really need to come up, we have to crack the code at that. We do a lot of outreach, but boy, it is a tough sell, particularly in our rural communities. And we just absolutely cannot fail at that going forward. We need people to be in the grocery store and our farmers markets, supporting our economy, and of course, feeding their families. So that's a focal point going forward that we just absolutely have to get better at. And then closing up, I just say that what we've built in the pandemic, working together, like truly collaborating, not just sort of saying it for the camera, but actually working together, sharing resources, figuring out how our food bank can support our friends upstream, right? The Community Progress Council, the Human Services Department of the county. Their success and their mission means our lines are shorter. So what can we do to help? You know, where can we make a difference from the food insecurity side? What is that? And listening to our partners tell us that, because it's not all about money. Sometimes there are other services we could provide to help. So, so those are the things that we need to do better going forward.
Thank you, Joe, and thank you to all of our panelists. I want to open it up to see if there's any questions. Dave Mickley.
First of all, I just want to thank the Community Foundation for putting this together. We're all, let me speak for myself, I'm not so excited about Zoom meetings as I was a year and a half ago. It's a very positive energy in this room, and just a wonderful hearing the stories firsthand is great. So thank you, Community Foundation, and thank you all. My question is, 3 years from now, if we were having this same breakfast, what would be the subject of the collaboration and the sense of pride of what has been accomplished? And kind of each of you.
I'm holding the microphone, so I'll jump in. I really hope, and I believe this is possible in your county, and then Pennsylvania beyond that. I hope we're talking about the successful application of the resources that are flowing now, both from public and private sources, that we're actually leaning into work that's going to help families be more resilient, help people not fall through the gaps, maybe help fix the, in our sort of public assistance services there, it's kind of like Chutes and Ladders. Remember that game, right? There are so many trapdoors and cliffs on dollar levels that someone can go from being sustainable to unsustainable, or their family, with a move of $1, just hitting that. And those structures have developed over time and been kind of layered on. If we could, at this unique time, kind of pull that apart with our lawmakers and really get after that for the same money, we can avoid pushing people into desperate situations where their decision sets are somewhere between bad and terrible, and really help them there. At those inflection points, it costs a lot less. We can save money doing it. The other thing I would say is, we haven't talked a lot about healthcare, but healthcare on a preventative side. In our world, food is medicine. I hope we're into it pretty deep, but I hope we're talking about the benefits of that and how that's keeping people healthy. And again, not consuming healthcare resources at this alarming rate that we have in this locality and in this country. I hope we're talking about, boy, we're doing a great job on that.
So the question was, 3 years from now, what do you hope we'll be talking about?
Well, I hope our successes will have been that we've continued to work together. Again, I think 2 years ago, we may not have all been sitting on the same panel. We would have been talking about very different things in very different ways and not talking about it together. So I would hope that more people would be in this conversation and talking about how we've moved the needle on some of these issues. Housing is going to always be a priority. I hope that we make some headway towards stabilizing the housing in the community. And I hope that, workforce also stabilizes and that people are back to work, children are back in childcare. And, there's sort of a new normal around that. And then the last thing I'll say to echo Joe is that there are lots of conversations around the social determinants of health right now in a very different way than 2 years ago. And so I think that we will probably continue to see public-private partnership that are addressing some of these issues in a holistic way with real funding that allows us to break down the silos in ways that we've never been able to do before.
Jess, you motivated to speak up? Nope, good. Other questions? Well, I hope you'll join me in thanking our panelists. Their work is very hard. They work long hours, and it's really their passion for the people of York County that drives them, and we're very fortunate to have them here. Thank you. I'm going to pass the mic to Mary Kay.
So good morning, everyone. I'm very happy to see you all here in person. This is lovely. And also those who joined us on Zoom, thank you very much. I'd like to take this opportunity to thank our partners and donors to the COVID Fund. And I'm going to read some of our major donors, so forgive me, but we want to thank especially the United Way of York County, the Kinsley Foundation, Powder Mill Foundation, Memorial Health Fund, Lee and Arthur Gladfelter Foundation, the Wareheim Foundation, Carol Wagman, the Women's Giving Circle, Dale E. Brower Foundation, JHC Foundation, Way Foundation, the Donley Foundation, Wells Fargo Foundation, and the York Daily Record. In addition to those, however, we could not have done this without our donor-advised fund holders who chose to make grants to our COVID fund, and also new individuals, families, and groups that chose to support our COVID fund, many of whom were first-time givers to the foundation. And through this year, our development team, which includes Phil Woods and Dorinda Grove, who are here and who I thank for their work this year, we were fortunate to be able to talk to a lot of those donors. And the common theme that we found was they were genuinely, profoundly grateful that they had not been significantly impacted through this pandemic. But they also knew close friends, other family members, neighbors who had been critically negatively impacted to their family's health and financial sustainability. And they were really looking for a way to give what they could to make the best difference. So that was why we wanted to have this conversation and be able to illustrate how well our grants team, along with our nonprofit partners, were able to utilize this funding to effectively target those most critical needs and create systems so that we could use the government funding that became available in the best way possible. But you also heard, unfortunately, that we're not out of the woods yet. We will be seeing additional crisis in our housing and our childcare. And fortunately, we still have some funding through our COVID-19 fund. And we also have our grants team and our nonprofit partners who are already looking at how is the best way to respond to that. So we're already looking for the ways to leverage that funding and any additional funding to make the biggest impact. As you heard this morning, Jane talked about our 60th anniversary, which we continue to recognize throughout this year. And as part of that, we want to have some deeper conversations with you, our donors and our partners, about what transformational giving means to you and what information and options you want to see from the Community Foundation so that we can help you make your lasting legacy. We look forward to having those conversations in the future. We thank you all for both your generosity and your time, and I hope you have a wonderful rest of your Tuesday. Thank you.